Hi, everyone. Welcome and thank you for joining us for this telephone town hall for all of our Rossmoor residents and constituents. I want to encourage you, if you haven't gotten a chance, to send us questions throughout this town hall. We'll try to get as many answered as possible. And if we don't get to your question, we will make sure we get to you back to you afterwards. So you can send any questions to this email, assemblymember.Bauer-Kahan@assembly.ca.gov. That was a lot, but it was in the email you received, so you can look there as well. Before we get started, I just want to take a moment to say thank you to our community. I know it's not easy to practice social distancing and deal with all of the interruptions to our everyday life, but our community has really pulled together and done a great job with sheltering in place, and it's given our healthcare workers a fighting chance. You are doing your part by staying home, and today we'll talk about ways to make that a little easier on you. I also want to thank all of those who are on the front lines, working hard to make sure our community is safe and prepared. Our healthcare workers, our grocery store workers, first responders, and many more who are keeping us functioning every day. Both Senator Glazer and I are here to support you. Our offices are still opening and functioning. So the best way to get in touch with us is to call our offices or email us. And it's that same email address I just gave you. And you can also reach out by telephone. The phones are being answered. So I want to introduce who we have here for this conversation today. First of all, my partner in the legislature, Senator Glazer, is here to join us, and he'll have some comments and words throughout the town hall, I hope. Welcome, Senator.
Thank you very much, Assemblywoman.
And he's been doing an incredible series of town halls on many different subjects, which I'm sure will continue as we continue to fight this virus. We'll hear from Tim O'Keefe, CEO at the Rossmoor Golden Rain Foundation. He'll talk about Rossmoor's response and what they are doing to help. We'll hear from Dr. Louise McNitt, the Communicable Disease Programs with Contra Costa Health Services, about their efforts to flatten the curve and hear about stricter guidelines and what we can do to keep our community safe. Nicole Howell is here. She's the Executive Director of the Ombudsman of Contra Costa, and she'll discuss services for seniors and ways to stay healthy and engaged throughout the shelter in place. Terry Kilgore, Assistant City Manager for Walnut Creek, is here to talk about the city's resources and things they can provide for the community. We'll discuss the state's response and some important financial information for all of you. And lastly, we'll make sure to answer as many of your questions as we can get to tonight, although the Rossmoor audience is always very prepared and has great questions, so I can't imagine we'll get to all of them, but as I said, we will get back to you. So first, I want to welcome Tim, the CEO of the Rossmoor Golden Rain Foundation, and give him an opportunity to answer some questions. I know that Rossmoor was way ahead of the curve in shutting down events and club meetings towards the beginning of March, which was incredibly smart, and it mitigated the risk to the community. So I want to thank you for being so responsive to the needs of the community from the beginning. Could you talk a little bit about what Rossmoor is doing to combat the virus?
Yeah, so thank you, Assembly Member. So let me start with what we began doing at the beginning of March. I think it was March 6th, that was the day that the county announced the first infections in Contra Costa. That evening, I had a conversation with County Health Services Director Anna Roth and her deputy, and we talked for quite a while that evening about what steps that Rossmoor should or could be taking to help mitigate this and keep the community safe. So by 8 o'clock the next morning on Saturday, we began taking the first steps, which was to cancel all large events. We canceled them immediately. We, at the time, the guidance was a 3-foot social distance. So we imposed that across the community at all of our facilities. We reduced the size of all the classes that we were running in the various facilities starting that day on Saturday. We canceled the movie, which at Oscar time is not popular to cancel the movies, but we shut the movie theater down on that Saturday. We shut our women's conference, which was going to feature Christine Pelosi on that Monday. So that got shut down. And then from that point on, it was about education and letting the community know what was going on. Just a few days later, on March 10th, the county had new guidance, and which was effective on March 11th, which moved the social distance to 6 feet. And then it also increased our sanitization that we were doing across all of our facilities. So we started doing it more frequently. All the classes then at that point were canceled. All meetings were canceled. Then just a few days later on March 16th, effective early morning on March 17th, We closed all of our facilities, and under the public health order that was issued, the first public health order that was issued, we are continuing to operate only essential services, which mostly are around maintenance, emergency type services and that kind of a thing. So yeah, those are the things that we've implemented. And then, as you know, the county health department just issued a new update to their health order just yesterday. And so we have taken steps to further reduce the scale and scope of staff services on site. All of our buildings, of course, are closed, but there are staff working in some of them. But the new order is more emphatic that if you can work from home and you're an essential business, you have to work from home. So we've now moved a couple dozen more employees to be able to work off site. And so we're down to pretty much a minimum of staffing on the campus.
Can you tell us a little bit about what resources there are for the Rossmoor community during this time? Do you have delivery services, any social opportunities?
Well, social opportunities, so that's a challenge, although I'm always amazed by the creativity of the Rossmoor community. So I know that some of the homeowner associations are hosting small events in their courtyards where people are spread out and distancing, social distancing. And they're waving and they're banging pots and pans and that kind of thing. So that's all good to help keep the whole idea of community. Then the Rossmoor Fund is while it's not affiliated with the Golden Rain Foundation, it's a separate charity servicing the community. I've spoken with Claire Wolf, she's the president, and I see that she's one of the attendees here on this call. And she has said they are ready, willing, and able to help people with, emergency type assistance. And so I know that we put on our newspaper on a regular basis how to apply, what services are available, what kind of funding is available. And so we want to make sure that all residents that might need that help access it, and they understand that the Rossmoor Fund is there for them. But again, that's a separate entity. They're not affiliated with the Golden Rain Foundation. Let's see, what else? There's a whole bunch of things that we've been doing in the last couple of weeks since the first health order on the 17th. We update on our website regularly, the rossmoor.com website. And if you go to rossmoor.com/breaking-news, you will get to a listing of the current information about Rossmoor, how the health order is being enacted or affected in the community. We have links to the county's website, the state website, the federal government's, the CDC website, lots of places that our residents can go to get linked to the right information as opposed to conjecture and people that may not know what they're talking about, which is a lot of information on the internet and on television. We just this week, our two restaurants on campus, the Creekside Grill and the Carrie's Kitchen, both began takeout services, and Creekside Grill added delivery services that just began this week. So those are two ways for residents to get a prepared meal. Then we just introduced this week on, I think it was Tuesday, a program called, I think the name is escaping me. I think it's called, I think it's Choice Lunch. And they're in Danville. Mm-hmm. And what they typically do is put together a program for school kids and to getting nutritious meals, but they've expanded it to the Rossmoor community. And they're bringing basic essentials like milk and eggs and meat and fish and vegetables. You can order it through them. You pay for it online. And then they will deliver it, I believe, 2 days a week to the Rossmoor campus at the Gateway parking lot. So residents can then, that are either afraid to go to the grocery store or don't have somebody that can shop for them, can have a contactless drop-off of the food. They'll deliver it to the Gateway parking lot, and they've set up a protocol to minimize the personal contact. So we think that that's a great service. We can't vouch for the service ourselves. We haven't really had an opportunity to vet many of these, although of course we know Creekside Grill and Carrie's Kitchen because they're on our campus. But Choice Lunch, that's brand new to us, but we wanted to make sure that the residents in the Rossmoor community knew about that. And I know that other churches, local churches, are doing some outreach. I know that St. Isidore's in Danville is reaching out to the Rossmoor community. We put that in our newspaper this past week. So if you do need some help, there are some volunteers that are willing and able to help residents either do shopping or, assist with whatever needs that they've got. In addition, if you call the Rossmoor administration line, it's at the Gateway Clubhouse. We do have staff that are answering that phone, and we're taking a lot of calls from people who are either not comfortable using a computer to place an order, or they're not sure how to use a computer, or they might not have a smartphone. Our staff can help you place orders to any of your restaurants or anybody that you need help with. We can help you place those orders. So we have staff that are able to do that. And then the delivery, whatever the service is or the restaurant, you have to make your own arrangements for delivery or pickup. But if you do that in tandem with, say, St. Isidore's volunteers, perhaps somebody could go in and pick those items up for you. So we think
and
that
there's also information on your website and in the newspaper?
It is. Yes, it is. Yeah.
Nice.
So we think that there's a lot of resources that we've tried to make available for our residents, and we are seeing a lot of activity in that regard as well. We just want people to stay safe and remember that this isn't over yet till they tell us it's over. And I know we want to hear from our public health official here on this call as well, and she can fill us in on the current status.
Yeah, thank you. So one question we got from quite a few residents was people hoping to understand why fees are still being charged during this time for HOA fees and the like. Could you speak a little bit about that, and if relief is needed on those fees, how they can get it?
Yeah, so we've gotten a lot of requests for that, and that's tough. Both the Golden Rain Foundation and the homeowners associations in Rossmoor, they're called mutuals. They are nonprofit corporations that provide, recreational amenities or maintenance and that kind of thing, and running these communities. So you've still got, we're still providing services. We're still doing maintenance on units that have plugged toilets or leaky faucets and sinks, and or leaky roofs. We've got some rain, I know, in the forecast coming up this weekend. So we still have staff that are able to respond. We are still providing bus service. We operate our own bus line, and it has now been transformed into an on-call bus line. So we do have our buses can take up to 2 people at a time to the grocery store or to CVS or to John Muir or to Kaiser. And so we can do that, although obviously if we can only take 2 people at a time, there can be long waits to get onto the bus. So we're doing that. So we're still, in other words, we're still providing all these services. The lawns are still getting watered. The insurance still has to be paid. The other utilities, the gas, and so on. So these are neither Golden Rain or the mutuals are for-profit entities. There's nothing that can be cut unless we cut or reduce those services. So we can't stop the insurance. We can't stop the water. We can't stop the electricity. And homeowners associations most of them pay for those services. So that's all part of what we call the coupon in the Rossmoor community. Now some people have said, well, because you've shut down the amenities, there must be savings. So the amenities, that's the fun part of living in Rossmoor. That's why people typically move into Rossmoor, is to play golf or to play tennis or bocce or lawn bowling or table tennis or whatever. And yes, those are all closed. They are now locked, and that is by this week's order from the public health order. But the city of Walnut Creek had instructed us to lock things 2 weeks ago. So we began locking the things that we could lock. The things that we couldn't lock, we have now secured and installed locks on the buildings that didn't have those kinds of things. So all of our amenities now are shut down. But that doesn't mean that the cost to operate them are not continuing. For example, we still have pool maintenance, and we still have a certain level of a temperature that we need to maintain in the swimming pool. So there's still heating, water use, and so on and so forth. So there are still operating costs even for the amenities. And what people, I think, don't realize or understand is that the amenities are mostly funded, or to a great deal are funded, by fees. So if you play golf, you pay a fee to play golf. And it's also subsidized by a portion of the monthly coupon. But since early March, we've had virtually no fee income to offset the operating costs to even keep, the water going on the golf course and that kind of a thing. So, yes, there will likely be savings in certain areas, but it's probably going to get absorbed in other areas where there is not any savings. I have an executive session with our board of directors tomorrow, and we'll be talking about further cuts and reductions in things that we can either defer or costs that we can set aside, maybe deal with in a year from now.
Mm-hmm.
And so that may have an impact on the coupon. If there is any reduction in the coupon, it would likely come at the end of the year, and the reduction would be used to offset next year's rate increase. But at this time, we're really so new into all of this, it's very difficult to plan, especially when the rules have been changing on almost a daily basis, really, since early March.
And so is there a way for folks who need a little bit relief on some of those fees to get it?
I'm afraid that there isn't. Now, the Rossmoor Fund can be a resource, but not to pay your monthly dues.
Okay.
The Rossmoor Fund can help you with your medical bills. They can help you with other things, food and that kind of thing. But they do not, my understanding is that they do not pay or provide assistance to pay your monthly coupon or assessment from the mutuals.
Okay, but that's good to know that you can get relief elsewhere if
Right.
needed. Rossmoor Fund. Thank you. One question we got from Cindy Rapp is, do you think Rossmoor should limit visitors into the community?
So that's a good question. So every resident in Rossmoor, because there's only one way in and one way out, everyone has a legal right, every resident has a legal right for them and their guests to enter into the community. And we can do nothing to prevent that. By law. We're not allowed to lock the gate. Now, if the city or the state or the county tell us to, then we can. But until we get an order like that, we have to keep the gate open. Now, what we have seen is a fairly dramatic reduction in the gate traffic. It's about 50 to 60% lower than it is on a typical day. We compared it to a month ago and looked at that data just this week to see how that might have changed. So it's gone down by quite a bit. Most of the activity at the front gate is our residents. They're going to the grocery store or whatever, and they're coming back into the community. And then there's probably about 150 or so staff members that are still working on campus that are coming in every day as well. There are family members of residents and friends who are visiting. For those on the call, I cannot emphasize more that all residents in Rossmoor need to really take this seriously and do all they can to limit visitors, and that includes family members. I know that that's difficult and that's controversial, but that's the guidance that the governor has provided. That's the guidance that the county health order has provided, is that everybody should be limiting their exposure, and that includes to loved ones and friends and so on. So we really want to encourage residents to keep that to an absolute minimum.
Okay, thank you. I know I love visiting Rossmoor, and I haven't been lately, so I'm behaving. But thank you for everything you do at Rossmoor, and for answering all of our questions tonight. Sure. There will be more. But now we're going to turn it over to Dr. McNitt from the County Health. Dr. McNitt, I want to thank you and your colleagues for all the work you're doing on the front lines right now to make hard decisions and put in orders in place and enforce them that are not always easy for all of the residents, but I think are going to help us flatten this curve and really make a difference in the virus. Can you talk a little bit about what's happening in the county with COVID cases? And is the curve trending up? How is it trending up as fast as you expected? Just a little bit about what's happening in the county.
So, hello, everybody. Can you hear me okay? I know I tend to have a pretty soft voice, so I just want to make sure that you can hear me if I'm talking like this.
You sound great.
Okay, great. So the total number of cases in the county as of today is 276. So we do see the number of cases going up, but the number that I feel is a little bit more important and kind of helps us to know if our health officer order and our social distancing orders are working is looking at the number of new cases every day. And so the number of new cases every day has ranged from about 15 to 30. So has really kind of stayed around the 20 to 25 range, which I think is a good sign. So even though we are seeing more cases every day, we're not seeing we're not seeing the new number of cases like double or triple or go up by many times that you're seeing in other parts of the country. So I think that is an indication that a lot of these social distancing policies that are put into place are helping to keep the number of new cases within a limit at this point.
That is good news. Thanks for sharing that. Can you talk a little bit about there was a new shelter-in-place order that came out just this week, and can you talk a little about what the important takeaways were from that for people to know?
So it was basically put in place just to kind of tighten things up a little bit. I think there was some concern that there was some questions about what's an essential function and what's not. So I think the new order was helping to clarify that. And also there was a lot of concern that people were, even though maybe they were staying at home, they were going out to recreate, and a lot of recreational areas were getting very crowded on the weekends, and people weren't able to maintain social distancing. So the new health officer order just clarifies really what is an essential business, and essential business that are staying open have to have a plan for how they're going to keep their employees safe in terms of social distancing or working remotely. And then it also closed a lot of parks and recreational facilities that we wouldn't get huge crowds on the weekend.
Yeah, I went hiking, I think it was 2 weekends ago, and it was hard to keep 6 feet. It was so crowded. So I think that was probably the right decision. Can you talk a little bit about high-risk groups? So 65 years or older, or those with underlying health conditions. What are the most important recommendations for how individuals in those classes can keep themselves safe?
I think people in those classifications should just try to stay home as much as possible.
Mm-hmm.
If they have other ways to get their essential needs met, if they have other people that can do their shopping for them, or if they can get delivery services, if people need help with their shopping, they can also, I know the gentleman who just spoke, I don't remember his name, I'm sorry, Tim. Yes. So he was, Tim O'Keefe, your name is right there. So yeah, it sounds like Rossmoor has some great services in place for people who might need some help with things that have to happen outside their home, in terms of shopping and going, getting some essential items. If people cannot use the Rossmoor services, or if they need a little extra help, they can also call 211. And there's services available through 211 for people as well.
Great. What should one do if they think they might have symptoms of COVID-19?
You should call your healthcare provider. First step is always to call your healthcare provider. They can do, a lot of providers have moved towards doing phone or telehealth appointments, so you can have an assessment over the phone. And if your provider thinks that you need to have an evaluation, then they'll have you come in to be seen.
And so I know some people in Rossmoor live alone, but a lot live with partners. What should one do if you suspect your partner has COVID-19? How do you properly distance yourself? What do you do if someone in your house might be a risk to you?
That's a really good question. And I think it can be somewhat difficult depending on the size of your home and kind of how much room you have in there to move around. I mean, if it's possible for people to sleep in separate rooms and to, kind of keep that 6 feet apart from each other, if they can, if they have separate bathroom facilities, they could use separate bathrooms, but it would just be, fundamentally it's the hand washing, what we call respiratory hygiene, where people cover their coughs and sneezes. If you cough or sneeze into a tissue, throwing it away and washing your hands, and just keeping high-touch surfaces clean with regular household disinfectant. So doorknobs, countertops, your computer, if you're sharing a computer workstation, handles, drawer handles, all those kinds of things, just make sure you clean those regularly.
Okay, and what if someone on the call has a non-COVID related health concern? What should they do? Can the hospitals accommodate them? Should they be showing up at their doctor's office? Can you talk a little bit about that?
Yeah, they absolutely should access the medical care that they need. A lot of facilities now will kind of have a separate triage area for people who have respiratory symptoms. So just trying to keep people separate as much as possible. If they're coming in for non-COVID related issues. It's never a bad idea just to call beforehand if you feel you're having an issue and you want to get some guidance. I think calling beforehand is a really good bet.
This is something that I've heard a lot about. So we've talked a lot about get your food delivered, try not to go to the grocery. Is it safe to receive food in deliveries? Do people need to disinfect those packages? What's your advice there?
Yeah, that's a good question. I mean, from what I've read, I think becoming infected through food is very low risk. I think if you're concerned, you could always sort of wipe the outside of the packaging, when you first receive it. But I think probably that's a fairly low risk way to get infected.
Okay.
Just remember washing those hands.
Yeah. My kids, for the first time in their life, are washing their hands more than usual. So it's been good training in our house. So Donna Faye wants to know if there are any confirmed cases in Rossmoor, and if so, will they know? Will they be told?
Well, we don't disclose location information for patients because we know that there's COVID-19 in the community. I think we just have to assume that it's everywhere in the county at this point.
Okay. And do you know, so Dan McGrath asks, do you know what percentage of Rossmoor residents are expected to be infected in the next 3 months?
No, I don't know that information.
Do you have an estimate of county, what we expect county numbers to look like over the next 3 months?
It really, I don't really know. I think that, things change so quickly with this epidemic. I would hate to make any projections. I think there is modeling projections that are out there, but it's hard to take into consideration kind of everything that's going on, including all the social distancing. I think the social distancing is really the most powerful tool that we have right now. And I think that is the most powerful thing that will keep the number of cases, at a level that we can handle.
Got it. Testing. You probably get asked this question a lot, something that we get called a lot about. Can you talk about test kits? Sally Anderson wrote in to ask, do hospitals in our counties have enough test kits and respirators to handle the uptick in the virus? How prepared are we?
Right. So right now, I think we have enough testing and enough respirators to handle the number of cases that we have right now. Testing continues to be, the amount of testing available continues to expand. So as more commercial laboratories start doing testing, their ability to handle large volumes has improved quite a bit over time. In terms of ventilators and hospital capacity, we are managing with the cases that we have now. As long as we kind of can keep the numbers of new cases at a manageable level, I think we have enough capacity. We're also working, the county is also working on developing what's called alternative care sites. So there was just a contract signed with the Craneway Pavilion in Richmond to turn that into an alternative care site for people with COVID-19 who maybe don't need really high level like ICU care. And that's going to be, the equipment for that is being provided by the federal government. And there's also other alternative care sites that are being planned in other parts of the county. So we're planning for higher numbers of cases, but where we are right now, we seem to be doing fine.
That's good news. And I know the state is doing everything we can to make sure we're getting the counties the testing kits, the protective equipment, and the ventilators they need to deal with the surge if and when it happens. A question on masks. So 2 questions on masks. There was new recommendations that seem to have come out just in the last day about masks. What is the recommendation? Should people be wearing them everywhere they go? If so, what kind of masks should they be wearing?
Yeah, that's a really good question. And I think that the thinking about masks has really shifted. I think initially there was concern that we really wanted to kind of preserve masks for people in the healthcare setting. But I think, just in the last couple of days, CDC has come out with new information that it seems like the infection can be spread up to 48 hours before people develop symptoms. So 2 days before they become symptomatic, it's possible they can transmit to other people. So I think in light of that information, people wearing a mask, really they can help protect themselves and the people around them. So if people don't know that they're sick yet, if they wear a mask, that can help to contain the secretion so they're not transmitting to other people. I think we need to preserve medical grade, like surgical or N95 masks for the healthcare setting. And in the community, people are making handmade fabric masks. I think those would be completely appropriate for people to wear in the community, as a way to protect themselves and to protect their fellow community members.
So Judy Johnson, who's on the call, says she's been sewing a lot of those masks and wanted to know your opinion of them. So you think they're appropriate for the community to wear, but maybe not as appropriate for our medical healthcare workers?
Right. Yeah.
So
I think when we wear a mask out in the community, it's really to protect the people around us. So, maybe we've just started to feel a little bit sick, or maybe right before we start feeling sick, if we have any virus in our secretions, so that mask will contain those secretions, so you're not getting them out into the community. And it's also a good way to remind people not to touch their face. So you'd be less likely to, maybe do that nose wipe and then touch something, or, people scratch their face all the time. So I think that the fabric masks are completely appropriate for the community. The healthcare setting is a little bit different. The masks in the healthcare setting need to offer a little bit more protection for the healthcare worker themselves, because they're in very close contact with people who are potentially have very high viral loads that could easily contaminate the healthcare worker.
All right, well, thank you. I think it's been incredible to see all these people who are sewing all these masks and trying to help. So it's good to know we have a good use for them. Well, thank you. And again, thank you for everything the county's doing to keep us safe. And the numbers that we've been seeing, as you mentioned, really show that the decisions that the health department have recommended have helped. So thank you for your continued work in making great decisions for our community. Appreciate it.
You're welcome. Thank you for having me.
Of course. And now we're going to turn it over to Terry Kilgore, the Assistant City Manager for Walnut Creek. Terry, the whole Walnut Creek city staff has been incredibly and working tirelessly to help all of our constituents in Walnut Creek. So thank you for that. Can you talk about some of the safest ways for Rossmoorians to go grocery shopping? I know there are some senior hours and other things. What's your recommendation?
Absolutely. Thanks for having me, Assemblywoman. We have been working very hard for our community, and we know the community's been working hard to keep each other safe. So you can see behind me lovely downtown Walnut Creek via hologram, and hopefully when all this is over, we'll all get together and have a nice glass of wine to celebrate. But thank you for staying away during this time. So what the city has done is set up on our city main webpage. You can click, there's an icon that says COVID-19 resources, or you can go to www.walnutcreek.org/senior help. And that'll take you to a page where we have specifically sorted out those grocery stores that have senior hours. It'll give you their phone number, their hours, and any special considerations. There's obviously other businesses that have gotten into the grocery game. Some of our downtown restaurants have gotten creative and are doing general store food deliveries where you can order online and they'll either deliver to you, or you can do a scheduled pickup where you're the only person in the restaurant. One of those is Beer House. It's a new restaurant downtown, and so they're trying to get creative in how to get quality food to people where some of our stores are seeing shortages of key types of ingredients. Meals on Wheels is a resource for those that need someone to bring them food. Food Bank of Contra Costa County is obviously experiencing high volumes, but is here as a food resource as well. And through all of this, our restaurants are ready to provide deliveries. If people are interested in not cooking, if you're like me, I miss my restaurant food. And so the city has a web page called Open where you can look and see what restaurants are still functioning and are able to do either takeout or delivery. So, and finally, I would add, if you just don't know where to go or what to do next, much like some others have mentioned, we've set up a helpline.
Mhm.
It's the senior center phone number repurposed since we can't have the senior center open, and that's 925-943-5852. And even if you can't get someone online, if you leave a message, we'll call you back as soon as we get off our other call. So we're here to help, whether it's transportation, you don't know where to find some of the resources we talked about tonight. Our staff is there just to help you with whatever you may need.
Thank you so much. And what about if they need prescriptions delivered? Do you know if there are any prescription delivery options?
I believe there are. That's not my expertise. I had heard rumor that Kaiser was going to, but I'm not sure if it's live yet.
Okay, and I know Senator Glazer's on the call. I was on one of his town halls, and I think I heard that CVS was doing delivery.
Yeah, thank you, Assemblywoman, if you can hear me.
Yeah.
But many of the pharmacies are doing personal delivery, and they're also doing curb drop-off. So if you call your pharmacy, work out the medication, the renewal, or whatever it is, that they can both provide a potential delivery option as well as a curbside, meaning you pull up to the pharmacy and they come out and they put it on your windshield, so there's no connection that creates any kind of transmittal. So there are options on both major pharmacies that are out there in our communities.
Awesome. And we heard, we got a note from Loretta Landucci about having trouble with there being no delivery options for Safeway and Whole Foods and having not great success with Instacart and some of the other options. But I know we heard a little bit about some of the restaurants. Do you have any other advice, Senator Glazer, from your call about how best?
Thank you, Assemblywoman. We had the president of the Northern California region for Safeway on my town hall today, along with the leadership from Rite Aid. And they've made it clear that they are providing, the grocery chains are providing delivery, they're providing curbside options, they're providing third-party options, meaning that you contract with a third party to go and shop for you and bring the groceries directly to your home. So now they had some trouble. Obviously, this is a whole new phenomenon that we're facing. And yes, they did have some issues for the last couple of weeks, both in the supply chain and also in the ability to honor the commitments that have been made on their website when they said a 7-day pickup or a 7-day delivery or whatever it was. They told me today that they're about, next week they'll be 90% back to capacity on inventory. And they've been hiring, Safeway said today they've hired 3,100 new employees.
Wow.
In the last 10 days. And a lot of them have come from the restaurants and the hotels and motels that aren't working right now. They've tried to bring those staff over to their operation. There's a training curve that they have to get over, but they're massively increasing. They've acknowledged that they haven't done what they expected to be able to do the last 2 weeks, and they have a high expectation that they're going to be able to do better. The inventories are up, and they think they're going to be doing a lot better on delivery and curbside pickup. And it is all about trying to be safe, right? And making sure that, especially for our seniors, that they don't expose themselves unnecessarily. And I know that there's still going to be stumbles as we go forward, but they're working very hard to clear up both issues, inventory, and we know that sanitizer and the toilet paper and these other things, essential things are not there. We had a very thorough discussion. If you want to listen to this town hall, by the way, it's on my website, and you can absorb all the details that all of us did today from the leadership of the grocery and pharmaceutical world. But they're getting better. We've had trouble, and I'm giving you a little more encouragement that I think that we had some excessive buying a few weeks ago, so it knocked off the inventory chain. And they talked about there's gradually getting back to a normalization. And I know that those who are watching or listening appreciate that, because this is a stressful, uncertain time, and that has created a change in our buying behaviors, and that has affected the ability of our retail, pharmacy, grocery chains to accommodate that.
Yeah, thank you for that, Senator. I knew you had that town hall, so I appreciate that insight. And Bob Haas wrote in asking if we should be worried about food shortages, but it sounds like no, everything's coming back and the supply chain is correcting for some of that overbuying that was happening.
Yeah, I mean, there's some specific issues, and I talked about sanitizers, toilet paper, eggs, milk. There are some issues there, but as they said to me today, by the way, 2 weeks ago, they said there were only 65%, inventories were only about 65%, 100% being great. They expect to be about 85 to 90% next week. So it's bouncing back. People did overbuy. Yeah. It created a lot of impaction, and they're readjusting. So we're going to keep paying it. I know you're paying attention. I'm paying attention, and we're going to keep on them to make sure that we can make it as stable as it can in this difficult time.
Thank you, Senator. So Terry, one more question. Do you know if anyone in Rossmoor is experiencing serious financial stress? Are there any agencies in the community besides the Rossmoor Fund that you know of that can help?
It depends on sort of what types of bills they're trying to pay. There's a variety of resources that are starting to offer grants and assistance with rent or groceries. So I would recommend they call the Senior Care Line. We can certainly connect them with the resources we know. And there are various charitable groups, as Tim mentioned, who are starting to step forward and say, we want to help. And so the city will be working with a couple of the major charities in the next few days to launch a new website. We don't have a name for it yet, so check back on our Facebook and social media pages, and we'll get that information to Tim as well. That will actually directly connect people with agencies and organizations that want to help, and sort of match make with those people who do need assistance.
Thank you. Any other updates you want to share about what the city's doing while we have you here on the line?
Well, thank you for all of you all's patience as we learn how to work remotely, just like everyone else. We are having daily meetings with our senior executive teams to talk about how we comply with these new orders that keep coming down from the state and the county to keep our workers safe and to help keep the community safe. So we're closing playgrounds. We're trying to keep as much as we can open so people can get exercise, but we need your help, as the doctor mentioned, in honoring social distancing, because otherwise we're going to end up closing a lot more facilities. So thank you in advance for your compliance. And if you need us, we're always here, 911. When in doubt, if you have an emergency, call 911. And if it's not an emergency, they'll help you figure out what to do with the situation.
Awesome. Well, thank you, Terry, again. We're grateful for your work, and I know the residents of Walnut Creek are grateful as well. So that hotline sounds super helpful. I hope people have questions and use it.
Thank you so much.
And now we're going to turn it over to Nicole Howell, the Executive Director of the Ombudsman of Contra Costa. Nicole, do you mind talking a little bit about some of the resources for seniors to keep them healthy and well?
Absolutely. Thank you so much for having me. I really appreciate it. Our government officials have done a great job during this time giving out information, and I appreciate the work of our local health officials. So the first number to call if you're a senior across Contra Costa County is 1-800-510-2020. That is the number to our countywide information and assistance line. And if you call that number, they are going to link you to whatever service you may need. If that's food delivery, legal assistance, ombudsman guidance, whatever you could need, they are going to like one-stop shop you right into what services they can provide to you. That is our local area agency on aging, and they are experts and they are trained social workers in how to support and help you. That is the first number that you should know. Additionally, it's important to know that there are other senior service agencies, and we are all trying to deal with the new normal, and who have a variety of services and supports that they can offer to you. So I also was looking at Covia Senior Resources. They have a variety of information on engagement opportunities for seniors. So to check that out, you should go to covia.org. They have a host of things that you can engage with and provide information, education, so you can still stay engaged during this time. But 1-800-510-2020. That is the one-stop shop.
Great, thank you. Can you talk about some, we know parks are closed, so recreation is changing, but people need to stay healthy. What are some safe ways for folks in Rossmoor to get out, stay healthy and exercise and get recreation?
So I, like you, am an aspiring Rossmoorian myself, and am very envious of all the green space and beautiful sidewalks with the flags to walk across the street. So I think it's important to remember to look around and realize those Rossmoorians like to stay busy. And so they do lots of activities, but you can walk out right outside your front door and you have beautiful streets to walk down and you have beautiful green space, maintaining 6 to 10 feet of distance, and that you can maintain activity as you are doing that within your space. Also, I myself have a balcony and I will go outside in the mornings and I will do exercises on the balcony and I will walk my dog down the street. It's important to look at our neighborhoods differently and see what we can do there and realize that there are lush possibilities for you.
Yes, well, I know that the Rossmoorians are probably missing their bocce ball and their cocktails at Creekside. But you're right, it's a beautiful place to be out walking. And my family and I have found new trails in our neighborhood we never knew about. We've lived here for decades, so it's true, we can rediscover our own backyards.
If I can interrupt for just a second, we have our own TV station, Channel 28, and some of our fitness staff have been recording workout videos to help our residents who are stay at home, and they just started uploading those. So if they're not there already, you'll see them, residents will see them shortly and be able to access just things that you can do in your own home or you don't need to go down to a fitness center. There's exercises like isometric exercises in a doorway, bracing against the door and against the door jamb above you. So things like that help people still stay active and still work on their physical well-being, but doesn't require you going outside and exposing yourself to potential contaminants or whatever. So we're looking at other things like that as well, other recreational programming that will hopefully help to both entertain and keep people busy with things too. So those are all coming soon.
That's great, thank you, Tim. My son and I did our online yoga today, so we're right there doing our in-home exercises as well, because it keeps us a little less cooped up. So what about technology? Nicole, do you have any advice for how people can stay connected with their loved ones, their friends, without seeing them in person?
Yes, and so I speak from personal experience on this one, and that is that my parents and I now are doing weekly Zoom dinners together. So they are older adults themselves and they live in another state. And so in order to stay connected and keep them engaged in the world while not leaving the house, we do weekly Zoom dinners, and I've done that with several friends. And so to that end, we have a section on our website at ccombudsman.org, COVID-19 resources, and we're actually adding several videos that you can access, which will tell you how to install Zoom, how to start a meeting. Those should be up, if not this evening, by tomorrow morning. So specifically, seniors can visit the COVID-19 section. They can watch the video and realize it is really easy. And if you're on this call, you've probably already mastered it. So maybe you can help a friend understand that over the phone and see how they can be engaged. So I think Zoom, FaceTime, Google Hangouts. I hosted a sing-along via Zoom a few weeks ago, and it was intergenerational, and I think that everyone can be a part of this, and we get to be creative and innovative and whatever works for us. The key is to not be alone in this, that we can be a separate but not alone. And I think it echoes the governor's call to check on our neighbors and be connected with at least 5 people, be calling them, be texting them, doing videos. How can you be sure that they are staying healthy and well during this time?
I love that. My family is doing a intergenerational Zoom Seder next week for Passover. It'll be our first time, so I'm excited for that. Got to do things differently these days.
Absolutely.
And then wellness checks. You mentioned that briefly, but can you talk a little bit about what's happening in the county to make sure we're checking on our neighbors and those that are living around us?
A variety of things. So my work centers around those who live in long-term care. And so we too are not able to visit our clients during this time. And so we are calling and texting and video chatting. But here in the community, we have several resources that are happening, which is the friendly visiting programs that you can access by calling that 1-800-510-2020, or Meals on Wheels, Diablo region. They are checking on residents or individuals. They are calling them. They are delivering meals. There's a variety of resources to make sure that people are still well. If you have a neighbor that you're a little concerned about, and of course you're not seeing them lately, it's okay to reach out and make sure that they're okay. Maybe either leave a note on their door, call them, contact someone who would have seen them more recently, but just make sure that everyone has the food and supplies they need. Also, you can call your local 211 for additional resources. And I heard questions about delivery of pharmaceuticals and things like that. You can access that by calling 211. There are additional resources that they have set up for that. So if that is the barrier to you getting the materials you need, please contact 211.
Thank you for that. And yeah, I mean, one of the things that makes Rossmoor so incredible is the community there. So I know they're probably all checking on each other and making sure everyone's got what they need. So, but we should continue to do that for each other. So thank you. I want to also share information from the state. The state is launching a hotline for seniors. You can reach it at 833-544-2374, or just go ahead and call that 211 number locally. But just, I'll repeat that number one more time if you want to call the state hotline. It's 833-544-2374. Thank you. So I want to provide, I want to thank all of our incredible guests. This was the information that we got tonight, I thought was really helpful, and I hope everyone on listening in thought so as well. I want to provide a little bit of financial information. We got some questions about what the state is providing in the way of financial relief, as well as the federal government. So as many people know, because you all are some of the most informed folks in our community, the federal government recently passed the large relief package, which included a check for those who are single and make less than $75,000 a year, or for a couple of those that make less than $150,000 a year in income. We're expecting those to be delivered in 3 to 4 weeks. We got a question on those checks from Lynn Letteris, which was, if you don't file an annual tax form, do you need to do something to get that check? First of all, it just came out today that everybody who receives Social Security will automatically get their check, the same way you receive your Social Security. And the federal government has said, no, if you are not filing, you most likely don't need to file. But if you don't get that check and you're expecting it, do call Congressman DeSonia's office, because they are also here to support you in getting that relief that is coming your way. On mortgages, which is, I know, something that a lot of folks are thinking about these days. On March 25th, Governor Newsom announced important mortgage relief for Californians affected by COVID-19. Eligible homeowners will be able to defer mortgage payments for at least 3 months. The relief package includes 200 state-chartered banks. But what's important to know about this is that it's not an automatic deferral program. This will not happen automatically. In order to be eligible for this mortgage relief, you have to contact your financial institution and fulfill their requirements. And then they'll give you that 90-day grace period. It won't affect your credit rating if you're eligible. And the lenders are there to provide a streamlined process and let you know that you've been approved for it. So do reach out to your lender, and hopefully you can get that relief if you need it. We also have worked, my colleagues and I in the legislature have pushed the utility companies and the electric companies to ensure that no one's getting their utilities turned off during their crisis. So there's a little bit of relief there. Don't worry about having your water or electricity turned off if you have a financial need. But again, if you are in a situation where this is something you're concerned about, reach out to the resources we've heard about tonight at the city or at the county. They are here to help you. I also want to talk about some of the tax deadlines that are coming up, something we've been hearing about a lot. Property taxes are still due on April 15th. Unfortunately, this wasn't able to be changed, but the county assessor's office has announced a program that will allow people to avoid paying fines if they can't pay it on that due date. So if you're unable to pay because of a hardship, you can call my office, Senator Glazer's office, or our local assessor to get more information on the relief on this property tax. State and federal tax deadlines have been extended to July 15th. However, you can still file now if you want to, but you have until July 15th to do so. Also, another question we've been getting a lot, so I wanted to mention on the state level, was the DMV. A lot of us coming up on our licenses being expired, and we don't want to go wait in line at the DMV, which is the right call. It's what the county wants you to do, stay home. So the DMV has said they won't be ticketing people with expired licenses for 120 days who are unable to set up appointments because they're in a vulnerable category, so including older Californians. We believe that they'll extend that deadline if the shelter in place extends. So don't worry about an expired license right now. Stay home and be safe. So I want to encourage you all to check my website. We've compiled an exhaustive list of local resources. The county has a website, as you heard. Rossmoor does, the city does. There are a lot of resources out there for you. So please be in touch. I want to thank you all. I want to thank our guests for taking the time to be with us today. I want to thank you for joining us. We'll be hosting more telephone town halls, and as Senator Glazer mentioned, he has many on some interesting topics as well, some that he's already had that are available on his website, and I'm sure, and I know he'll continue to do those as the weeks go by. Thank you to all of our guests who work every day to serve our community and help all of our constituents get through this time, which is not easy on any of us. But continue to practice social distancing. As we heard tonight, it's working, it's helping. We're doing our part to really flatten this curve in a way that will be meaningful for our healthcare workers. So we will get through this together. I cannot wait to come see you in person. We'll be back at Rossmoor for a real town hall when this is all over. We had one that had to be canceled as well. But be well, and remember that we are just a phone call away. Senator Glazer is just a phone call away, as are all of the folks that were here to provide information tonight. Thank you, everyone.
Thank you. Thank you.
Thank you.
Thank you.